So traditional wisdom says that right when you become eligible for Medicare, you should enroll. But the thing is, in most cases, that is right, sure, but not always. And sometimes you should possibly, maybe consider delaying or even maybe not even enroll in Medicare at all. Now, this is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, as well as extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. Before we get to it, please don't forget to like and subscribe, because it does really help our channel grow, but also because it'll help keep you up to date about the newest Medicare changes, the newest Medicare options, and ways to make more, better informed Medicare decisions. All right, here we go. So getting Medicare is usually a pretty pivotal point in a person's life, at least for our clients. Usually is when the reality of retirement kicks in, when the reality of life kicks in, and also it can be a pretty nice step up in coverage from what somebody had previously, or even a big step up if they had gone without health care at all. This is because some of the major portions of Medicare coverage do not have a cost to them, or have a much smaller cost than somebody would have had through their work, or through a spouse's work, or maybe even from some other under 65-year-old program like a health exchange. But there are costs to it, and there are a minority of situations that a person would want to maybe hold off or decline enrolling into Medicare. So first, and the biggest reason that somebody may want to delay or deny getting coverage through Medicare is because of the cost. When someone turns 65 years old, and assuming they meet the minimum requirements to be eligible, primarily that they've been in the United States for 5 years and are a U.S. citizen or a resident, then they could enroll. But if they haven't paid into the Medicare payroll tax for a minimum of 40 quarters or 10 years, then it can be prohibitively expensive. This is because Medicare has two parts, Part A and Part B. And if somebody has seen money come out of their paycheck every month for Medicare for the last 10 years at least, then their Medicare Part A portion, that's the portion that covers hospitalization, will not have a cost. It will have been what you can think of as prepaid while they're working. But for Medicare Part B, though, that's the portion that covers kind of day-to-day care, there is always going to be a cost, regardless if someone has worked enough time or not in the United States. And in 2024, that cost is $174 a month. But if someone hasn't worked the 10 years or doesn't have a spouse that they may be able to qualify off of, then the Medicare Part A cost, the part that is normally free, actually has a monthly cost of $505 a month for the Medicare Part A, and then plus they have to add the additional Part B portion, which is $174. So that would be a total monthly cost of $679 a month for a health plan through Medicare, and I mean, frankly, that's a lot. Furthermore, for somebody who is in this situation, who doesn't have Medicare Part A for free and doesn't have Medicare Part B, or is not eligible for them, it may make sense to decline to enroll in Medicare because they have better options that are going to be considerably less expensive through something like a health exchange, or maybe even work, or maybe even Medicaid or Medi-Cal, as they call it here in California, especially if they can get help paying for their monthly health insurance costs. Another really important reason that somebody would want to delay waiting to enroll into a Medicare plan right when they become eligible is because they have other coverage. Now, a situation for this would be if somebody had coverage through a work coverage or a union coverage, or maybe even a spouse's work coverage. In this case, it would be possible to not enroll into Medicare at all, or more often is the case, would be to enroll in a Medicare Part A, which almost always is no cost, assuming there has been enough work history. But delaying the enrollment in Medicare Part B or Medicare Part D until that other coverage ends is a possibility. Now, one thing that is very important to understand, super important, doubly super important, is just because you have some other health coverage outside of Medicare doesn't mean you can just skip Medicare Part B and not pay the $174.40 a month, because, well, there is a penalty if you don't do it right. What I mean by this is that the rule for Medicare penalization is that if you have health coverage that is considered credible, and that word is very important, credible, meaning that it is equally as good as what is being offered by Medicare Part B, then you can decline enrolling into Medicare Part B because you already have equally good coverage and there won't be any sort of penalty. The same goes for Medicare Part D, which is the drug coverage. But If you are the kind of person who just doesn't want to pay the $174 and doesn't have credible coverage or has a coverage that doesn't meet the credible criteria, like an accident plan or something like that, that is when the penalty could apply if you decide not to enroll in Medicare Part B. For the Medicare Part B portion, it is a penalty that grows for the time you don't have credible coverage and don't enroll in Medicare Part B when you could have. Then if you ever do enroll in Medicare Part B, like most people eventually will need daily medical services, the penalty is added on top of whatever the current Medicare Part B cost is, and it stays added onto it for the rest of your life, which if you calculate it out could be really a lot of extra money just to pay because you waited. Also, ditto for the Medicare Part D coverage. So yeah, the long and the short of all this is that if you have credible coverage through your employer or somewhere else, then you can decline Medicare Part B and not have to pay the extra cost and also not have a penalty. But if you don't have credible coverage, then it's probably just better to enroll. The last, I guess, really good reason to not enroll into Medicare when you're first eligible is going to be if you are not going to be living in the good old United States. Now, I know we've had quite a few of our clients who do eventually retire and move outside the country once they retire. So that could be moving to the Philippines or moving to the Mexicos, or my personal favorite, moving to Italy. But yeah, if you are moving outside of the United States and you are going to live there permanently, it doesn't make sense to really have a Medicare plan, because Medicare is a great program and it's probably one of the greatest programs that the United States has ever invented of all time, but it doesn't do much good outside the United States. Or you can also move to Canada, which has free healthcare. Either way, if you are moving to live outside the United States permanently, yeah, that would be a good reason to delay or maybe even decline enrolling into Medicare altogether. But if you do decide to move away and then say, hey, you know what, it's not for me and you need to move back, then it would be important to enroll back into Medicare once you come back in the United States permanently. So to finish the video up, I want everyone to notice that there are many reasons to delay enrolling into Medicare, some that we covered and some that we didn't. But there's one specific reason that is not a great reason to not enroll or delay enrolling into Medicare. And trust me, we have heard them all. But that one reason primarily is that it is too expensive to enroll. Yes, of course, it does have a cost to it. And if you are sufficiently low income, and really it's not that low, it's kind of middle income, there are a lot of programs out there that can help you pay for some or almost all of the costs associated with Medicare. So things like low income subsidy, LIS, or Medicare Savings Plan, MSP, or even Medicaid or Medi-Cal if you are here in California. So there are things to help you pay if the cost is truly too expensive. That can come down. But if you just don't want to pay the $174, you think, hey, you know what, I'm healthy and I don't need any of these services and I'm never going to use it, I will tell you right now, you were wrong, because we see a lot of folks of our clients come in on the tail end of that who made that decision and then 10 years come in and say, oh, you know what, now I need to enroll and now I have a pretty big penalty. So just keep that in mind. It's something that you would need to understand, that maybe there are reasons to not enroll in Medicare, but there are far many reasons to actually enroll instead. All right, so that's it for today's Michael's Medicare, discussing when it would make sense maybe to delay or maybe even to decline enrolling into a Medicare plan. And if you have additional questions or you want to get more information about your specific situation, feel free to reach out to us at the information down below, or put it in the comments, or give us a call, or check out our other great videos on the socials on YouTube and Instagram. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.